I know I've said this before, that having been alive for longer than HIV has been around, I remember the really early beginnings of the disease when it was so much stigma and so few resources. So Nara, if you could talk a little bit now about the community resources that exist.
Oh, if you want to get tested, there are so many places you can get tested for free. I mean, for all the women out there, if you guys are going to get your regular PAPs, you can ask your GYN to give you a full panel of STI, HIV tests, and that should be completely covered by your annual, female checks, right? Or you can ask your primary care doctors, right? And if you happen to have no insurance, don't fret, because you can go to any Department of Health in the DC, Maryland, Virginia area. Also, I don't think a lot of people know this, but when you go to the DMV, and when I say DMV, it's the Department of Motor Vehicles, not DC, Maryland, Virginia. But when you go and renew your license, or you need to get new tags for your car, they actually do free testing at the DMV in the DC area. So, and not only do they give free testing, but they also give you a discount, in the sense that you can, if you're there to like renew your license and it's like, $30, they'll be like, well, you will get a $20 to $25 off whatever you're here for, so that you can get tested for free. So, I mean, I've been in the DMV sitting, and you're in the waiting room, right? Like pre-pandemic, and everyone's sitting there. You take a number, you're waiting for your number to be called, right? There's a person that comes out and makes an announcement, says, hey, anyone in this waiting room that wants an HIV test, you will get a $25 or $20 like voucher for whatever you're here for, and it's completely anonymous, and it'll be really quick. And they do this thing called the OraSure, which is a mouth swab, and that's when it comes back, and it can be reactive or non-reactive. There's also a second form of test. It's called a rapid test, and it's a test where they kind of prick your finger. It's like a couple drops of blood, kind of like when you do diabetes sugar levels, right? And you find out if it's reactive or non-reactive within 60 seconds. I mean, those 60 seconds when you're getting it seems like a lifetime, because you're sitting there kind of like, do, 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 the Jeopardy song going on. But, I think the biggest thing that I really try to tell people is knowing your status is the first step, right? Like, I mean, I personally would feel horrific if I unknowingly infected someone when I had something, right? And also, with the Department of Health, if you know that you have something, even if it's not HIV, chlamydia, gonorrhea, and you've had sex with some people, if you're embarrassed to tell them yourself, you can call the Department of Health. You can do an anonymous notification, tell them the names and numbers, and the Department of Health will contact or go find the people that you need and get them tested and treated too. So, yeah.
So what happens for folks who found out they're HIV positive and now they need to be on the medications? Is there support for that through their states? Do they have to worry about draining their life savings?
So if HIV medication is covered by most private insurances and also Medicaid and Medicare, a lot of our kids come through. And if you don't have medication, there's these patient assistance programs through the pharmaceutical companies that we can do. Also, even if you have private insurance and you have like high copays or high deductibles, there are copay and deductible payment assistance that we can apply for, and it's completely free. So we really try to take away as much barriers as possible, right? And with our clinic, not only do we have licensed social workers, but we also have a nutritionist. We have licensed mental health clinician. We have cooking classes. We also have this thing called Uber Health, and it's a HIPAA certified section of Uber, and our hospital has a contract with them, and so we're able to send a car to them. We have door-to-door service, so we can pick you up from your work, your school, your home. get you here, get labs done, see you, have a chat, get your labs done, and then send you on your merry way back to work, back to school. And so talking about community resources, I think a lot of the thing that I've been doing a lot lately is talking about PrEP, and it's PrEP. And I'm sure a lot of people have seen a lot of commercials, right, on Biktarvy or Descovy. And so with that, PrEP is pre-exposure prophylaxis. And I know it's like a big medical terminology word, but I like to tell them it's a one pill, one study you can take to help prevent HIV. So I like, when I'm talking to a teenager or even a young adult, I say, you know what? It's like birth control for HIV. When you take a birth control pill, you have to take it every single day around the same time for the efficacy to be, high, right? And with PrEP, if you take it every single day, it's 99% effective. And, obviously with that too, if you miss doses here and there, then the efficacy, slowly goes down, the percentage, right? And, I think with males or people that are born as a anatomically male, you have to be on PrEP for 7 days so that it's fully in your system, integrated, and you continue to take it. For females, it's a little unfair, but we have to take it for 20 some days because of how our bodies metabolize, right? The medication. So, but regardless of that, you can get on the medication. So right now, it's Truvada. Truvada is the big pill for, and then Descovy. So Truvada is good for men and women, and then Descovy right now is only FDA approved for men and or anatomically male. So, and then another thing that I feel like a lot of people don't know about is PEP, which is PEP, and that is post-exposure prophylaxis. And that's a medication that I think a lot of people in the medical field know a lot about, because people, especially in the ED, right? If you get an accidental needle prick, right? You don't know where that needle's been, right? So a lot of nurses I've known have had to go on it, and it's for 28 days straight. And you have to get on the medication after exposure within 72 hours. Like, that's really crucial, because you want to be able to get the medication into your body so that it helps prevent the process of the HIV converting in your body. So I always describe PEP as plan B for HIV. So, I really, when I talk to patients or I do education, I really try to make it, real life scenarios and like real life examples to kind of like, because when you're kind of like shooting out medical terminologies to just teenagers in general, they tune you out, right? Mm-hmm. Or it goes in one ear and out the other. But when you really try to engage them with like things and everyday occurrence things, or things that they've heard before, and they're able to kind of make that connection, it really helps with solidifying in their brains.
Excellent. Thank you for all of that. We're going to put in, for those of you who don't live in the DMV area, the DC, Maryland, Virginia area, we're going to try to put in some links in the descriptions for where you can find resources to get tested in your local area. In terms of finding, I mean, not everywhere has a great Uber door-to-door service, but if you have been recently diagnosed, please reach out for support. You're not in this by yourself. And the sooner you can get a support system going, the better your time is going to be with us.